Hi, today I'm going to discuss about one of the very important topics. There are a lot of people who come to us with a kind of hearing loss, and they are very much concerned that whether if he or she loses his or her hearing, it means that we need to wear hearing aids. Are hearing aids necessary for all kinds of hearing loss? Let us take you through a small video where I'll be discussing about the various types of hearing loss and what are the treatment modalities of it. See, the hearing loss means a decrease in his hearing levels. Now, it could range from a mild, moderate, and severe, which we assess through a definite test called a pure tone audiogram. A pure tone audiogram is something which help us to diagnose the amount of hearing loss and also about the pathology or the cause which might be resulting in cause of hearing defect. Now this hearing loss, if you can start with, could be due to a simple ear wax present in the external auditory meatus of the ear, of the external ear. The next very common thing is could be due to any ear infections, any ear infections growing in mass like called a cholesteatoma. It could be due to infections in the middle ear leading to destruction of the middle ear ossicles called the malleus incus stapes. And in some conditions, it could be due to accumulation of fluid in the middle ear called otitis media effusion. Next, the next part which may lead to hearing loss is the inner ear, where it consists of two parts. One is the cochlea, which is responsible for the hearing, and the other part is the vestibule, which is basically for the balance system. Now, if due to any condition, it could be noise-induced trauma, noise trauma, physical assault, it could be due to any accident, it can be due to any viral infection, or it could be due to any kind of age-related degenerative changes or any genetic factors. All these things, if causes a damage in the cochlear nerve, then that can result in a sensory neural deafness. Now, the external ear and the middle ear, the deafness caused by the external and the middle ear usually lead to a deafness called as the conductive deafness. Now, this conductive deafness can usually mostly be treated either by medications, which can lead to some antibiotics, can mucolytics, can nasal decongestants, and in some instances can be cleared with the help of surgery. Now, surgery, there can be two kinds of surgeries. One will insert a small tube to release the pressure from the middle ear, which is called the otitis media effusion. Next, another surgery called ossiculoplasty, in which basically we replace the middle malleus incus stapes of the bone in the middle ear with a tauroprosthesis called the total ossicular reconstruction prosthesis, or POT, partial ossicular reconstruction prosthesis. So these are some of the surgeries we basically do to improve the hearing losses if there is a middle ear problem. Now, coming to the last part. Now, if the problem is due to the inner ear or the cochlear damage, then in majority of the cases, the surgery usually doesn't work. In some of the Western countries, or in India also, they have been started of doing cochlear implant surgeries for this sensory neural deafness in aged populations also, but with not much scientific improvement in those. So in these patients where the cochlear nerve has been damaged, in majority of these patients, if a proper adjustable hearing aids have been fitted, then you are absolutely improving your hearing levels. But the hearing aids have to be of the proper adjustment or proper age related selection of the hearing aids and proper amplification and proper programming of the hearing aids is very essential for a clear improvement in his, to achieve a clear improvement of his hearing levels. Now, To sum up, if you are having hearing loss, it's not always that it's going to you wear a hearing aids, and it's not always that it's going to a permanent loss and you have to stay with it to the entire lifetime. But you need to check it early, whether it's due to simple viral infection, it could be due to what is the cause, whether it's a middle ear pathology or it's inner ear pathology. So you can easily go to a ENT doctor and or a otologist doctor who's doing extensively work on vertigo and balancing or hearing problems. You can get an idea about what's the main cause of hearing aid and try to get abrupt prompt treatment, which will help you to get relief from his symptoms very soon. Thank you.